a webinar about MMIs and preparation for MMIs. Presentation was made by myself and Chloe. And like I said, my name is Esther. This is me. I'm currently an FY2 in East of England, an academic F2, currently in A&E. And Chloe is a third-year medical student who is currently studying at Keele. So yeah, we're both interview officers within 2Med School. So just a quick slides just about webinar etiquette. Obviously, we want everyone to be respectful to the speakers and students when people, do interact. Please also complete the feedback forms at the end of the webinar. There is a QR code on the side of the screen that is for a Slido. And this is just for everyone to put in any questions throughout the webinar that you have about anything I've said, about anything you're worried about or concerned about, or just something you'd like to know. So yeah, just do send in your questions. There'll be a Q&A at the end. So yeah, if you put them onto the Slido, Chloe and I will have a look and we'll try and answer as many of them as we can at the end of the webinar. Please don't send anything inappropriate. Any of those inappropriate questions will be removed, but we just want it to be an opportunity for you guys to share any questions that you might have with us, and yeah, we'll see if we can answer them for you. Yeah, plan for today. We'll just talk about MMIs very briefly, and then we'll go through some very sort of common topics that do come up in MMI interviews. So motivation to study medicine, talking about work experience, sort of reflections, and also sort of skills, the skills that are required of doctors and medical students, and some top tips at the end as well. So yeah, just a few of the really common topics that do tend to show up in MMI interviews and also your panel interviews as well. But yeah. Okay, so an introduction to MMIs. MMI stands for multiple mini interviews. It's the most common way to be interviewed for medical school now. So probably if you'd asked 15, 20 years ago, it might have been panel, but quite a few, especially the newer medical schools, are now opting for multiple mini interviews as opposed to panel interviews. You've got small stations that usually have a topic that's underlying them. It can be between 5 to 10 minutes on each station, and they are marked independently. So really importantly, each station is a fresh slate. Whereas obviously with panel interviews, you're with the same interviewers for the duration of the interview, which can be 15 to half an hour. And yeah, it's the same people. Whereas with MMIs, it's a fresh slate with each station. So you have an opportunity to improve from the last station, which is really important if you thought you had a really bad station in the last one, just to pick yourself up and then get started with the next one. Okay. So these are the medical schools that are currently using MMI interviews. So as you can see, it's the majority of them. So odds are any medical school you apply to will at least 2 or 3 of them will use MMIs as opposed to panel. I think the only ones currently that are currently using a panel will be, Oxbridge, Imperial. Those are the only ones I can remember. Actually, no, Imperial's now moved on to this. So actually, Oxbridge. So yeah, for the vast majority of them are now using MMI. Okay, there are a few sort of themes that the stations tend to be revolved or sort of are based around. So the first one would be the motivation to study medicine. So those are your questions like, why do you want to study medicine? Why being a doctor and not being a nurse or a PA or etc. And then we have qualities of a doctor. So what does that? What do you think the skills that a doctor needs? What do you think are the skills that a doctor needs to have? So teamwork, leadership, communication, empathy, and then the role of a doctor. So understanding the realities of life as a resident doctor. So they'll ask you what are the difficulties, for example. What do you think are going to be some of the challenges that you'll face? And then you have questions about, not knowing about the NHS or current public health issues. So they might ask you about the junior doctor strike. They might ask you about, certain sort of how applying for training works or things like that. Communication skills. So you might have to explain something to a patient or break bad news. Medical ethics. So you've got, the Bauer case, the Charlie Gard, I think, case. So you've got, cases that are in the public sphere that you might have heard of before. Sometimes they might give you some information prior to the interview to ask you to read about before you get there. That could be about ethical ethics as well. Then you might have to talk about your work experience or your personal statement, and also knowledge about your medical school. So they might ask you, why do you want to come to this medical school in particular? What draws you in to this medical school? So there's obviously a wide range of things that they could ask you. We're only going to touch on a couple of those things now, but it's up to you to obviously go after this to have a look at some of the other things that we don't speak about, and just brush yourself up on those things. But also there are other webinars, for example, medical ethics, that Intermed School are also running or have run before. So make sure to have a look at the previous webinars if you didn't attend those, okay? Any questions at this point? So I will continue. All right. So the first sort of topic that we're going to sort of target is the motivation to study medicine. This is obviously one of the most frequently asked question types. It's very easy to under-prepare or over-prepare for this. So you run the risk of sounding like you've not thought about it, or you have rehearsed it and become sort of very robotic. This question really is looking for a good knowledge of what being a doctor entails, reflection on previous experiences, so that can be clinical, academic, personal, an understanding of the difficulties of medical school and a career in medicine. So you need to show that you know what being a doctor is like. You've experienced some sort of clinical aspect, or work experience or volunteering aspect that has prepared you for some of the skills or some of the issues that you might face, and you understand what the challenges of being a doctor are. So you don't want to sound like everything's going to be just unicorns and roses, and you also don't want to sound like you're not aware of actually what being a doctor entails. So it's really important that you guys have practiced this question prior to all of your interviews, panel or otherwise, or MMI, because this is one thing that pretty much all medical schools will be asking about. Okay. So one of the things that you can use to help with this is something called the CAMP technique. So it's a really useful tool when you're talking about motivation to study medicine. And it looks at sort of 4 aspects. You've got the clinical, academic, management, or leadership, and personal. So for work experience, you're looking at, or clinical, you're looking at work experience, shadowing opportunities, any volunteering. And for this, remember to be specific. You don't want to sound like you haven't really engaged with that experience, or you haven't really reflected on it. So be specific. What exactly did you do? What exactly did you see? Even if it's just one specific experience, make sure you've actually, thought about it, and you're really specific about it. Any academic achievements, you're thinking sort of coursework, EPQ, sort of that sort of stuff. Any management, goodness, there's so many typos in this slide. I didn't realize. Share any examples of leadership roles you've undertaken, and discuss your hobbies or non-academic interests in the personal aspect as well. If you want to see, this is a sort of a bad example, I'll reach out to you, and we talk about why this is a bad example and what a good example could look like. So if someone would ask me, why do you want to study medicine? I could say, I've always wanted to study medicine since I was a small child and one of my family members was unwell. I remember the doctors being really kind to my family members and providing them with good care. I have always wanted to help people, and I think being a doctor is the best way to do that. I'm also really interested in science, and I've done a lot of reading and research into the biology of the human body, which I find really fascinating. Ultimately, I want to be a doctor because I want to take care of people and provide them with the support my family members' doctors gave to us. So obviously, it's quite a short answer, first of all. But secondly, we've got, overused elements like since I was a small child, which can come across as quite cliche, even if that is the truth. You don't want to sort of use overused or cliche sounding sort of phrases when you do answer this question. So avoid things like ever since I was young, or ever since I was little, or since I was small, or I've always wanted to study medicine. Just because it can come off as, quite cliche. And yeah, so there are other ways to start. Again, there's not any specific examples. You've just said, oh, I remember the doctors being kind to my family members. I think, again, this is where being specific is really important, like what exactly was said, how exactly did that make you feel. There's no reflections on any clinical or non-clinical experience. So yeah, I do think you can definitely you can definitely expand more on this experience to make it a really good answer. And there's no insight to what being a doctor really entails. They've not mentioned anything about the skills that are necessary or anything about the challenges that they might face and how their previous experience has prepared them for, tackling a role as a doctor. Okay. Now I'm going to contrast this is going to be a very full slide, so just preparing you guys to a good example and what that might look like, okay? So this person starts off saying, my motivation for medicine stems from multiple experiences I've had over the last 2 years. I was first drawn to the study of human disease during my GCSE biology, where we did a module on communicable and non-communicable disease. I read a lot around the subject and started to become more fascinated with disease that affect human populations and how they are treated. I was fortunate enough to do some local work experience at a GP surgery and sat in with the doctor as they saw patients, diagnosed them, and provided them with advice and treatment. This was when my understanding of medicine, of what medicine was, really began. I saw that aside from the scientific aspect, how much human interaction and communication formed a part of the medicine. I sought out further shadowing in the hospital and was amazed at the variety of patients and illnesses I saw. I saw how they were treated individually, but with high levels of care. Management. While acting as president of my sixth forms biomedical society, I was also able to develop some of the interpersonal skills and attributes vital for success in a career in medicine. Most importantly, I was able to develop my leadership and communication skills, communication and team working skills while organizing events for fellow students. Outside of my studies, I have taken part in my school's choir over the last 6 years. This experience has allowed me to learn about the importance of dedication and commitment in improving my knowledge. I'm hoping to use these skills during my time in medical school, and I understand that medicine is a lifelong commitment. That's what it should say. Okay, so what makes this a good example? If anyone can just unmute and let me know, what do you think makes this a good example? Or pop it in the chat if you want to. Is that Natalie?
I think from the set that you just showed, it does not use cliche examples like ever since I was a child, but it was separated into different categories, which makes the example becomes specific and more stunning to the interviewer.
Exactly, yeah. So first thing you notice is it's got a really good structure. It's very easy to follow. It doesn't go CAMP, it goes ACMP, but it's definitely targeting all 4 of those categories, yeah. It's got a good intro, it's got a good conclusion as well. There is some sort of specific examples there about being in a local GP surgery, acting as president of their biomedical society, and even talking about GC biology, exactly what was the thing that made them interested in medicine. So yeah, you've got definitely more specific examples than the previous one. Yes, definitely. There's also the beginnings of some reflection as well there. This isn't by any means a great example, but it's definitely a good place to start. So yeah, in comparison to the previous one, definitely touching on more of the aspects, definitely a longer, more thought out answer. And I would, if I'd heard this in any of the interviews I sat in, I would not be, I wouldn't be displeased with this answer. I think it's a really good place to start. So if you want to use this structure to think about what how you might answer this question, definitely do jot it down. I'm happy for you guys to send me any examples that, any of your answers to my intermed school email address. Happy to respond to you guys, not a problem. So yeah, if you want to jot this down, have a go at writing it, and then yeah, feel free to email this to me. If you want some, advice, or you want someone to proofread your answers, happy to do that. Yeah, so good. So that sort of leads us really well into talking about work experience. This is another really big part of questions that can come up in MMIs. Sometimes they might link this to your personal statement and be like, oh, can you talk to me about this particular experience that you shared in your personal statement? Can you elaborate on this? So sometimes that can happen. Usually they'll ask you about, a time when you've demonstrated a skill, or how did you learn this from your work experience, or when did you see this on your work experience, or tell me about a good experience or a bad experience that you had during your work experience. So definitely you need to be aware about your work experience, and you need to be sort of used to answering questions about that. Okay. So has anyone heard of the STAR technique? Anyone able to elaborate? Just feel free to unmute and let me know what you think. Has anyone heard of this before? Does anyone know what it stands for? Hi, has anyone heard of this before? Oh, who's this? Bramina?
It's like the sort of structure that you'd use to answer like questions based on work experience. And the S basically stands for situation, the T stands for task, A stands for action, R stands for result, and then the last R stands for reflection.
Super. Yeah, exactly. Really good. Thank you so much. So it's really useful for talking about your work experience. And like as you said, it stands for situation, task, action, result, and reflection. So yeah, those are the things that are really important that you mentioned when talking about your work experience. And again, it's another really useful structure. So you talked about camp, now we're talking about STAR. So yeah, really easy way to remember, really easy mnemonic to remember. So situation, task, action, result, and reflection. Okay. So situation, this is probably the shortest part of it. I would say couple of sentences, just a brief introduction into the scenario. So what was going on? So who were you with? What happened? When this happened? Why was it happening? Where was it taking place? Just an introduction into the scenario. So for example, I volunteered at a food bank during the COVID-19 pandemic, or, as a medical or as a sixth form student, I volunteered at a nursing home, or I worked as a HCA, at this hospital during the pandemic, or just again, very, very brief. What were you doing? Where was this taking place? What was the situation? Then you've got another sort of building up of what was going on. So what task needed to be done in this situation? An action would be, how did you fix the problem? Was there anything that you encountered? So the task would be like any problems you encountered during that, or any opportunities you encountered during that work experience. Action is, how did you fix the problem? Was there any techniques that you used? Did you change your communication? Did you practice any sort of leadership or teamwork? Did you sort of show any empathy? This is really where you would start to bring some of these qualities of a doctor in, or qualities of a good medical student in, or so this is where I would bring it into the action. So problem solving skills, etc. Results, so what did you achieve? How did that change things? What were the consequences of doing that action? So you're sort of building on from the last point. And the last thing would be your reflection, and this should be the longest part, the bit you should spend the most time really sharing and talking about. So what did you do well? What could you have done better? And how would this experience vitally make you a better doctor, a better medical student, a better candidate for this medical school to accept into their university? Okay. There's no need to hold off if you've done anything wrong. So if you felt like, you could have done something better, or, something didn't go exactly as planned, that's still really great to reflect on. You don't have to reflect on just good experiences, and actually sometimes reflecting on, you know, bad experiences can also be really useful, and can also paint you as being someone that's very self-aware and you know, able to improve and grow, you know, based on sort of weaknesses and things. So this is also really useful, reflecting on sort of bad experiences. Expand on what you would do differently next time. How would you change your practice? How would you change your action? So yeah, definitely do focus more on the reflection than on the other parts. So we've done situation, task, action, result, and then we've just talked about reflection. An example that sort of would go through all of these things. So like we said, volunteered at a food bank during the COVID-19 pandemic. Given that we had PPE, I found it really difficult to communicate with the service users that were hard of hearing. Initially, I adapted my communication techniques by using hand signals and writing information down wherever appropriate, but I raised this to my manager and we implemented the use of transparent plastic face masks instead. The service users really appreciated this being implemented. Looking back, I should have had the foresight that this would be a barrier to service users, but as soon as I noticed, I rallied to implement this as soon as possible. I am proud that I was able to make our service more accessible. Reflecting on this situation will make me a better doctor because I have become more observant when people are facing communication difficulties, and I'm now more aware of how to adapt my communication accordingly. So really good use here of the STAR technique. Definitely the beginnings of a really good reflection. You could definitely, you know, expand further about and talk about, you know, non-verbal versus verbal communication skills and how you found, you know, you could have said how I've started to use more non-verbal communication cues in order to better communicate to patients that might be hard of hearing, or deaf, and all of this again this is a really good start in talking about any experience that you've had. Again, when it comes to talking about work experience or experience in general, if you are someone who hasn't had a lot of hospital work experience, then you're not necessarily at a disadvantage if you can you know, reflect really well on any other experiences that you've had. So this person here is volunteered at a food bank, and they're able to talk here about communication. They could use a similar thing to talk about sort of leadership skills or problem solving skills or even empathy, just in this specific scenario. So you are not at a disadvantage necessarily if you're able to reflect on, you know, experiences that you've had that aren't necessarily in a hospital. Obviously, it's really good to have experiences working in being in a hospital or in a GP practice or a clinical scenario. But if you are someone who has struggled to find that, do sort of make sure you've got some sort of caring role. So if you're working at a food bank or volunteering at a nursing home or a school or a shelter, all of that can still be really useful, provided you know how to reflect on it properly. Okay. Any questions at this point? Okay, I'll move on to the next slide. So if anyone is happy to unmute and happy to talk to me if you'd like about a time when you saw, you know, good teamwork on your work experience. Feel free. This is again really informal. It doesn't have to be perfect. It's just for you guys to have a go. So if anyone is happy to, that would be great. If not, that's completely fine. Okay. I mean, so this can be an opportunity for you guys to jot something down, using the STAR technique. Again, if you want to send this one to me as well, happy for you to. But if anyone wants to give it a go, I know it's obviously quite a public platform, so no problem. Who's this? Ramina?
Yeah.
Thank you. Yeah, so would you like to talk to me about a time you saw good teamwork in your work experience?
Yeah, so there was actually a time during my work experience at the hospital where I observed a group of doctors who were actually examining a patient who had recently had a fall, and this was in particular in the geriatrics unit. And by observing how like the team of doctors worked together in the MDT, so the multidisciplinary team, I basically was exposed to the importance of like the intricate communication between the doctors. And as a result, this resulted in the patient actually receiving the best patient experience, as well as patient-centered care, which is really important according to the GMC. And I think overall, this experience, it really, again, it exposed the importance of teamwork within the hospital environment, and how it enables like the doctors to foster an open and positive working environment. And it also sort of enhances that doctor-patient relationship.
Lovely. That's really good. Thank you so much for sharing. And yeah, so really good start. I think you opened the situation really well and the task really well. I think you also sort of started reflecting on that really well as well. I liked the use of, you had some really key words there, sort of like open working environment, patient-centered care. They love to hear those things in your interview. So yeah, really good start there. I think what I would also say in this situation is probably bringing a few more sort of skills in. So I know they're talking about teamwork here, but obviously, really key to teamwork, for example, is communication. So you could talk about how the team communicated either between themselves or to the patient. Maybe they explained to the patient what was going on, or they maybe had to, speak to another member of the team to get scans, or to get investigations done, or explain to the patient what was going on. So another thing you could bring in there is like the really be important to communication. You could bring in the word sort of holistic. They love that. Multidisciplinary team. They love that. So yeah, I think really good start, and thank you so much for sharing with us as well. Really appreciate it. And yeah, I think you did that really well. Definitely a few things you can improve on, but yeah, really good start. Thank you so much. Have you got any questions for me? Is there anything you would like you have a question about, in particular about your answer, or if you don't, that's completely fine as well.
Was that enough like reflection?
I would say it could definitely be a bit longer, and you could definitely reflect on it some more. A tip I would say when it comes to especially MMIs is they have a list of questions. So they'll have a starting question, for example, talk to me about your work experience. And you talk about your work experience and you finish, and they'll be like, okay, so tell me more about teamwork and your work experience, and you finish that. Tell me more about communication and your work experience, and you finish that. And at some point you might run out of examples. So I would say not that you should go on sort of ranting for ages and ages and ages, but it's good to flesh out your answers, because then it limits the number of tricky questions they can ask you. If you've only got a 5-minute station, and your answers are on average 2 minutes long, then that's like 2 or 3 questions they can ask you. But if they're 1 minute long, then that's 5 questions they can ask you. So I do think it's worth making your answers just a little bit longer. Again, don't go on for ages and ages and ages. Do know when to stop. But that's one thing that these structures are really good for. So with reflection, we'll talk to you about how you can make that a little bit longer and how you can flesh that out a bit in a few slides to come. But I would say you can definitely reflect a bit more. And in your reflection, I'd say you can have a structure within the reflection as well. So have maybe 2 or 3 points that you actually want to reflect on, as opposed to just saying, okay, I'm reflecting on this experience, but actually say, okay, we're going to reflect on this, and then we're going to reflect on this, and then we'll reflect on this. If that makes sense. So it might actually structure your answers a little bit better. Does that make sense, Bramina?
Yeah, thank you.
I think someone's got their hand up. Annie?
Hi, I've got a question.
Yeah.
Does it necessarily have to be about hospital work experience, or can you talk about other work experience, such as like working and a part-time job and stuff like that?
Yeah, so yeah, like I said before, you technically can use any experience. So I'll let you know something about me. I actually wasn't able to. This is ages and ages ago now, 2016. That I wasn't actually able to find any hospital work experience before I applied for medicine. Because I sort of applied not knowing that I applied kind of on a whim. I wasn't sure what I wanted to do. I knew I wanted to help people, wasn't sure necessarily how. So I applied for medicine, and I didn't have any hospital work experience. But I was really lucky in that I'd worked in a nursing home. I'd worked in a school before with special needs kids. I'd worked. I think that's pretty much it. So I worked in a nursing home and in a school, and so I was able to reflect on those opportunities. In my interviews. So you don't necessarily have to reflect on being in a hospital or being in a GP, provided that you've got good reflections and you can link all of those things back to working as a doctor. So if you can link it back to having team working skills, communication skills, empathy, teamwork, leadership, yeah, all of these things that they're looking for in a good medical student and a good doctor, then I think you should be okay. But that doesn't negate the importance of having, obviously, hospital work experience. But if you don't, then you can definitely still, reflect on the experiences that you do have. So just if you're in the interview, they ask you about hospital work experience, say, oh, I don't have, I've not necessarily been in the hospital, but I have done this and this is what I've learned, then I don't think you should be penalized for it. Again, I can't say what each medical school will do, but if they've invited you to interview, then I'm sure they've read your personal statement, so they should already be aware of the experiences that you've had.
Okay, thank you.
Yeah, no worries. There's one more hand up. This is Tansuri. I'm sorry, Tanusri. Please correct me.
Yeah, the second one was right. Tanusri.
Tanusri. Okay, lovely. What question do you have?
I want to ask, if it's a question like this, would it be all right if we talk about like multiple different times that we saw it, or is it better to stick with just one time and like really flesh it out?
I would say just probably if it's a really short example, you could possibly do two. But I think it's better to have one really good example and flesh that out. So yeah, have one good example that you can talk at length about. And don't make it up, guys. Don't ever make it up. It doesn't look good. So yeah, definitely just have a good example that you've had and then flesh it out. If you've not really seen one in hospital, or you've not been in a hospital, then again, you can talk about another experience that you had that showed really good teamwork. Yeah.
Thank you.
Hope that answers the question. And then I think the last hand is for Natalie.
How many work experiences do you recommend us to do to make our personal statement more stands out of the crowd?
I see. I don't know. Having one good one, I think, is fine. In terms of work experience, definitely still do your extracurriculars. If you want to volunteer, that's completely fine. You could have one and that's really good or three that are not good. Like it really all depends on how you reflect on it. So if you're someone who's done like 3 or 4, but you don't know how to reflect on any of them, then there's really no point in having 3 or 4. If you have one that you've really engaged with, you've reflected on it really well, you've reflected on it in your personal statement, you can talk about it at length in your interview, then I think that's completely fine. So really and truly, it's up to it's down to you on how well you can reflect on those experiences. So I won't say that there's any good number. You just need to be able to reflect on them, essentially.
Thank you for answering my question.
No worries. Thank you. Okay, so I think we'll move on from this. Thank you again, Bramina, for answering. Okay, let's move on to the next slide. So this is just a mark scheme, I think, that we have created within Into Med School. This isn't particularly for any medical school, but this is something that they might have in mind when they're scoring your answers. So again, a really, really important here. I know you can't really see my cursor, I don't think. So really important here is that they've mentioned in the 3s, you can see they are well structured. They show reflection and insight. They have they're quite specific with their use of evidence and examples. They've used well-selected examples, and they're also good at communicating. So, and I know we haven't reached the tips and tricks here, but when we do get to, I'll just talk about it now before we get to the end. One really important thing is, especially in your online interviews, is just maintain really good eye contact, speak clearly, look like you're interested in what's going on, smile, be yourself. Those things will really come through in this interview. So that will help at least give you some marks when it comes to communication, building rapport, being engaged with the interviewers. I know I'm one of those people that I can be really shy and quite stressed when it comes to things like this. And that can sometimes hinder you, even if you're a really good candidate in expressing yourself. So do try and be really engaged, look, interested, speak clearly, and even if it's for that short period of time, just fake it till you make it, fake the confidence if you have to, just to get through that interview. Okay, lovely. So really good things we've talked about already. Red flags that we do not want to see, and I don't want you guys to do when you get into the situation, is that you struggle to describe the experience. So I would advise all of you at this point to have a diary of all your work experiences that any experiences really that you've done. So volunteering, your any charity work you've done, any hospital work you've done, GP, have a diary. Write things down. Okay, that just start thinking about those experiences. Have a good point for everything. So a good point for teamwork, communication, leadership, empathy. What else is there? Problem solving, and start to put some of your ideas to paper at this point prior to you guys getting to interview season, which I think is probably starting right about now, anyways. And if you guys are in year 11 or 12 and year 11 or 12, then you have a lot of time. So definitely do start getting some of these things to paper. If you haven't had the experiences yet, then it's when you do have them every day, write something down, okay? Just so that when you get to your interviews, you're not struggling to remember. You describe the situation without elaboration or reflection. So don't spend ages describing everything that happened. So I did this, and then this happened, and then the consultant said this, and then the patient said this, and then the patient said that. We don't need to hear that. What we need is a brief overview of what happened, and then the reflection. Again, don't be untruthful. Please do try and do tell the truth, because sometimes you can see through if someone's lying, or an immature reflection. So again, really surface level. You want it to be like sort of in depth. You're really thinking about what happened, how it made you feel, what you thought about before, how it's going to change your practice. Those are the things that we're looking at. Okay, we've got hand up for SSH. Yeah, hi.
I just wanted to ask, so for questions like why medicine, for example,
Yeah.
is it better to include like straight away your understanding of like other healthcare professions and stuff like that as well, and saying why you don't? Or do you think we should wait for them to ask a follow-up? Because obviously I'm trying to obviously think of an answer. And I don't know whether to put that in. And then if I don't put that in, then they might be like, okay, well, he doesn't, he hasn't mentioned anything about that.
I don't necessarily think you should say it in the first instance, because not everyone asks the follow-up question as why not nursing or being a paramedic or being a PA. So so I wouldn't necessarily put it in the first instance, but do have some thoughts about what you would say if they were to ask it. I think the question is why medicine and why not this. So you should be answering why do you want to do medicine in the first instance. And if they do ask you about the other things, then do have something in mind if you were to be asked that, but answer the question that they are asking you initially, which is why medicine. And that question is big enough for you to be able to spend a lot of time talking about it anyway. So that's what I would advise. No worries. Thank you. Alrighty. Let's move on. So another really useful way of reflecting. So we talked about the STAR technique, which will help you structure your work experience answers. And now we're talking about reflecting, which I think is one of the really tricky things when it comes to, you know, being in medical school interviews, because everyone says reflection, make sure you reflect, but maybe they don't necessarily tell you how to do that. So a really useful, you know, tool is something called Gibbs reflective cycle, which this is, I've heard about it a lot this year, completing a PG cert, keep talking about it, but it's really, really useful for everyone. It's not just for doctors, for, you know, in all spheres of life. Whether you're a teacher, you get taught about a Gibbs reflective cycle, doctor, same thing, medical student, same thing. And so again, you start off with a description, which you, if you look at the STAR technique, we've already covered that in the STAR. And then when you come to the reflection, I find it really useful to think about how the interaction made you feel. So how the thing you witnessed made you feel. So yeah, you saw a doctor maybe communicating with a patient in a really empathetic manner. Did they change their tone of voice? Did they change their posture? Did they sort of get closer to the patient? Did they maybe even draw things out for the patient? How did that make you feel? Did you feel comforted by them? Did you, you know, did you find that surprising? Did you find that interesting? Was it something new that you hadn't heard, like hadn't seen before? Was it successful or unsuccessful? How did the patient react, or how did you react? You know, was the patient, you know, really, what's the word I'm looking for? Reassured by it? Were they angry? Were they sad? Were they happy? Was it successful? And then why did you feel this way? So maybe you'd had a previously bad experience or previously good experience, and like, why do you think this happened? You know, was the patient you know, finally heard? Did they feel like they were finally heard by this practitioner that was speaking to them in this way? And then what did you learn? So taking a step back from that, you know, seeing that situation, how is that going to change, you know, what you would do as a practitioner? What did you learn from that? So, you know, maybe you learned that there, you know, there are multiple ways of de-escalating a really sort of aggressive encounter, or there are multiple ways of changing your non-verbal communication that are also just as important as, you know, your verbal communication. And taking that to your own medical practice, you know, will you take on that approach? Will you do the same thing? Will you do a similar thing? Or maybe it was a really bad experience and actually I wouldn't do that. I wouldn't do that. You know, I might do this instead. So if it's something that maybe you did, maybe you were in a difficult situation, and maybe you had a team leader who did something and, you know, it changed the team dynamics in a negative way, perhaps you wouldn't do that thing. So I think this is a really good way of approaching reflection, and I would definitely use this if you're talking about your work experience. I find it a really good way to at least start thinking about your work experience. So definitely do jot this down, have a go at linking some of your work experiences to this and thinking about the skills of a doctor, and maybe start coming up with some answers for questions that you might be asked. Okay, so here is a good one. So on work experience in a GP practice, a patient came in for a hypertension review but didn't speak fluent English. I observed how the GP used diagrams and more simple language to explain the condition. They ensured the patient fully understood the situation before they left by chunking and checking. I felt inspired by this interaction. The GP was able to communicate effectively with the patient. I found the GP's use of different techniques inventive and inspiring. Personally, I don't think there was much I could have done differently other than making use of the interpretation services available. This experience made me aware of the struggles that non-fluent English speakers may face when accessing healthcare. This experience has inspired me to further research the interpretation options available, so I'm familiar with them by the time I'm practicing. As a future medical student and doctor, I will ensure that I adapt my communication techniques wherever necessary so that the best patient care can be achieved. Okay, so this person here has really thought about what was going on in their situation. They thought about for example, how they felt about what the GP has done, how the patient might have felt, as well, and difficulty that they face. They thought about what they could have done differently, what they might do in the future, and yeah, so I think this is overall a really good example of some reflection. Okay, it doesn't have to be difficult. If you find this difficult, I've got another slide that has a maybe an even simpler way of thinking about reflection, but it doesn't have to be difficult. Okay, even though sometimes it can seem to be initially, there are definitely easier ways of breaking it down. Okay, so another way of sort of thinking about reflection is thinking about before, during, and after. Okay, you set the scene, same as before. You think about what were your thoughts, ideas, attitudes before, what went wrong, what went well, why, and then after, how did you feel, how did you immediately act, and then think about how it will change your thoughts, change your practice in the future. So that's another way you could do it, is a before, during, and after, if you feel like maybe the Gibbs reflective cycle is a bit too difficult. So you've got this one and you've got this one. Okay. I think both of them are a really good way to start. So lovely. So we've looked at some of these questions already. Before. Common mistakes when it comes to reflection: being too descriptive, not actually reflecting, not being specific enough, not linking back to the question asked, and really, really importantly, including the skills you've learned. There, honestly, I can't say, I can't say a bad word about including skills you've learned. Just keep chucking them in. All your little buzzwords, just chuck them in. Obviously, don't make it too forced, but I think it's really, really important that you guys are linking back to the skills that you've learned, and specifically the skills that they're looking for in a good doctor and a good medical student. You should be including them in your answers. Okay. All right. Last sort of section. Can anyone just tell me, I've already mentioned quite a few of those, what skills are expected from doctors and medical students? Feel free to raise your hand up, just unmute and shout out if you want to.
Resilience.
Good, resilience, yeah. Tanusri?
Compassion.
Compassion, good. Along that line as well, empathy.
Teamwork.
Teamwork, thank you. I'll just take two more and then, yeah. Who's this? Annie?
Good communication.
Communication, lovely. And Romina?
Leadership.
Leadership, lovely. Okay, yeah, so we've got quite a few there, which I think a lot of them are already included on here. Resilience isn't on there, but I think that's a really important one. Yeah, working under pressure, I guess that can link to resilience. Reflective practice, problem solving, teamwork, leadership, communication, compassion, empathy, motivation to study medicine. These are all the things that they're really looking for. And quite often you might have, stations, again, based off of these sort of skills, but sometimes you might not. And I think it's really important that you guys are linking back in the questions that you're asked to these skills. So when they ask you about your work experience, or if they ask you about why you want to study medicine, or if they ask you about, some of the roles that you've done outside, like for your hobbies and interests, you can always link them back to these things. And I think that's really important, and I think you should. Okay. So when you're approaching questions about, what are some of the skills you think are important for a doctor to have, I think it's really good to have just introductory line, and then to pick 2 or 3 qualities to talk about, and to talk about those things in a bit of depth. So consider why the qualities are important. Find experiences that you've had and that showcase that you've begun to develop this quality. Reflect on these. Again, you can use the before, during, after. You can use the Gibbs reflective cycle. You don't have to use the entirety of the cycle. if you think it's going to make your answer really, really long-winded, you can pick a few things out, reflect on these learning experiences, and then conclude and link back to the questions asked. Okay, so they might ask you to pick one, and that can be really tricky to pick one. But if they ask you, just to answer, just have a few that you can link back to your work experience and talk about in depth. Yeah. So it might look like this. I think that a doctor should have the following skills. This is because of the following reasons. During our work experience, I witnessed or I saw, this particular situation with this doctor interacted with this person and used really good communication skills. They changed their body language, they changed their tone of voice, they used nonverbal communication cues, or they drew things, or that kind of stuff. And this experience has taught me, going on from this, I'm going to change my practice in this way. And then in conclusion, I think this is an important skill, and I hope to keep developing this throughout my medical career. So that's how it might sound to you. Again, have a go at practicing this question with some of the experiences that you've already had, and have a good answer. Again, if you want to send some to me, happy to go through, not a problem. Okay, so this is our sort of final slides. There are lots of questions the medical schools ask, a version of, okay, that you'll probably get asked in every one of your interviews that you do. So you might get why medicine, sometimes why not another healthcare course. Really important that you already have an answer. Why this medical school? This is really important. So I got asked this at every interview I went to. So yeah, all of my interviews I got asked this. And it's really important that you have something that's practical and personal, is a way I like to put it. So practical thing is it the structure of the curriculum? So, do they do PBLs, or are they lecture based and more traditional? Do you get early patient experience, with placements and things, from year 1, year 2, 3? Do they do pro-sections or dissections? Is it what does the curriculum look like? And make sure that you really looked at it. So it shouldn't be, you should be able to talk about it. And then have a personal thing. So that can be either something that's really niche. So maybe have a look at their societies. Is there something that they have that maybe most other medical schools don't have, like a Quidditch society or something? Or, if it's Barts, for example, because that's where I went. If it's Barts, you could talk about maybe Teddy Bear Hospital, or pre-hospital medicine, because we have that's a massive sort of part of Barts Health. For me, when I applied to Liverpool, I didn't end up going to Liverpool. When I applied to Liverpool, for me, my personal thing was that One Born Every Minute, which is like a show about women giving birth, was filmed at their maternity hospital, and I loved it. I absolutely loved that show. I thought I was going to become an obstetrician, sorry. And I loved that show, so I mentioned it, and they thought it was really funny. And I was like, I know you think it's funny, but I really like that show. So something that comes across really personal, that you know about the city, or about the university, or about the hospitals. So yeah, have something practical, have something personal that you can say, and really well thought out. Do some research. It really stands out when a person has done research about the university, why that specific place. Make sure you've done some research. How have you demonstrated commitment to medicine? If you get stuck, use the introduction, 2 to 3 points, conclusion format. You can use that for any question at all. Introduction, 2 to 3 points, conclusion, if you get stuck. So how we demonstrate commitment to medicine? You can talk about your work experience. You can talk about your what do you call it, your extracurricular activities. You can talk about academics. Again, this is another way of just saying why medicine. It's literally another why medicine, but just rewritten it, so you can really talk about the same things. And if you get stuck, you can use the intro, 2 to 3 points, and then conclude. Practice as much as possible. If you need to, in front of a mirror, if you need to record yourself and look at it over, even though that sounds really cringy, make a question bank. There are so many question banks available on the internet, Medic Mind, or gosh, there's so many of them that just, if you have a look, you'll find lots and lots. So make a question bank, find a question bank, and just collate answers into like a massive Word document. Make a reflection book for all of your experiences that you've had, whether work experience or volunteering, etc. Know your NHS hot topics. So know the things that are likely to come up. So, this year alone, we've obviously had strikes. We've also had, gosh, what else has happened this year? We've had the Lucy Letby case. Obviously Charlie Gard that comes up. How a Garba case comes up sometimes. What else can we get? Know who Harold Shipman is. Know the GMC. So know your sort of hot topics, the things that can come up. Sometimes they're to do with ethical issues, things like, our aging population, obesity crisis, those kind of things. So know the pillars of medical ethics. There's an ethical seminar. I won't talk too much about it, but go and have a look at that if you need to learn more about ethics. And then research your medical school and make sure it's the right fit for you and know their teaching style so you're prepared for questions on it. Okay, so if you have still got any questions, please do put them on the Q&A or feel free to share them with me now. Here is the QR code. I will stop sharing for a minute just so we can answer questions, and then I will start sharing again just for the last slide. So let's have a look. Chloe, are there any questions at the moment on the Slido?
Yeah, so at the moment we've got 7. A couple of them are specific to Keel, so do we mind if I start with those?
Yes, please.
Yeah, so one of them's, hi Chloe, could you please talk about the Keel interview? How's it structured? Any tips or advice? When can we expect to hear back with interview offers? So just for context, if anybody doesn't know, my name's Chloe, I go to Keel. I'm currently a 3rd-year medical student. So I applied to Keel in 2021, so just after COVID pandemic was sort of starting to settle down. So my interviews were online. I've just done a little bit of research, and apparently they are still online. They still seem to have a similar format to how they were when I first applied. So for me, there were 2 online Teams interviews. The first one was about 15 minutes, and then there was another one that was also about 15 minutes on the same day. Obviously, I'm not really at liberty to say much about what questions came up. I'm not really allowed to, but the only sort of advice I could give you is be confident. If you're not, kind of try and fake it till you make it. It's 15 minutes of your life to try and, really win you a medical school offer. So be confident, be chatty. I found the Keel interview more informal than my other ones, if that brings you any sort of comfort. Just be yourself, be chatty, and you will be okay if you take a deep breath before you answer any questions. Try and structure your answer as you're sort of taking that deep breath, and reflect as much as you can, really. In terms of hearing back, I had my interview sort of mid-January, but I know some of my friends and my housemates had theirs in March sort of time. So Keel are renowned for being a little bit slow when it comes to the interviews and the offers, but I got mine about a week after my interview. But I know some people that got theirs a couple of months after the interview, so it's not really anything particularly linear. I wouldn't say you can predict when you're expecting to get your interview offer or your actual medical school offer. So try and be as patient as you can. I know it's a really tricky time and it is stressful, and you're trying to revise for A levels and you do have a lot on your plate, but the offers will come. Just let them come to you, really. You've done the hard work now. You just need to demonstrate that you can do the things that you've put in your personal statement. The other Keel related question is, how long do we have before each question, each station to read? I would say I got given about a minute, but I believe I started before the minute was up because, maybe I read a little bit quicker than other people, I'm not too sure, but they pasted it in the Teams chat. I had a minute or so to read, and then I let them know when I was ready to start. But obviously that could change. Maybe if you get extra time in exams, you might be able to ask them if you could have a little bit of extra time, maybe the 50% or the 25% extra that you do get. Actually, one more key question has just come in. Is it MMI? For me, as I said, it was just 2 stations. I would say it's typically in the MMI format. There were 2 interviewers on each station for me, but they did have a theme like an MMI station would. But as I said, they were on Teams. It was pretty relaxed. Those are all the key ones I could see.
Okay, there's one about, should I avoid mentioning my motivation to study medicine for my mum's cancer experience because it sounds bad and cliche? I'm really sorry if my answers made it look like your, personal experiences would be bad and cliche. Definitely do speak about your experiences if they have motivated you to study medicine. I think I was trying to say that you should avoid sort of cliche sounding phrases. So in my motivation to study medicine, I spoke about my own experience with medical professionals and how it was actually a poor experience and how actually that spurred me into thinking about what a good experience would be like and how I could provide that. So I would say definitely do talk about those experiences if they have spurred you on to think about career medicine. I think the important thing is how you reflect on it. I think that's literally the most important thing is how you reflect on it. What have you learned from that experience? How has it changed your viewpoint? How is it going to change your future practice? That's really the most important thing. So do speak about it, but just make sure you reflect on it. I can say that. So for anyone who's in that same position and had an experience with healthcare, whether it's themselves or their family members, you can speak about it. Just make sure you're reflecting on it. Yeah. Do you have anything to add, Chloe?
Yeah, I completely agree. If there's something that sort of spurred you on to pursue medicine, absolutely mention it. Obviously, that's quite a life-changing diagnosis, and it must have been quite a lot for you and your family to go through. So having that sort of patient side of healthcare is something that not every doctor or medical student has been through. So it is a different perspective to sort of bring to the interview, and I think it would be valuable to mention it. Just make sure you do reflect. That is really what they are looking for. But yeah, bring in any personal experiences you like, really.
Yeah, hopefully that answers your question. There's one about that's just come up. How should ethical questions regarding a case like the Lucy Letby case be structured? There is a ethics seminar, which I think the next question is about it. It's on the Into Medical YouTube channel, I think, and I think it should be available for everyone to watch. So if you type it into Google, I think it should, or to YouTube, I think it should come up.
It does. I just checked
it does.
it.
Yeah. Good. Okay.
Yeah.
So into med school, it should come up. It's quite recent. So you should be able to sort of approaching a case like Lucy Letby or any of the other ethical cases, you should be able to find that on there. But just really briefly, really with most ethical issues, you just need to present a balanced argument, really. So you just need to present an argument that's balanced. Avoid making sweeping, strong statements generally, and just show that you've considered the ethical, like the 4 pillars of medicine, ethical principles like autonomy, and confidentiality, capacity, and the four pillars of medicine, and you're pretty much good to go if you could do all of that. Chloe, any additions?
No, I think just having a really structured answer is the way to go. Make sure that you've got the structure down, or probably like practice over maybe the Christmas holidays, practice sort of doing things on the fly maybe. So maybe ask your family members to ask you a question a day and then give you some feedback. And talking to anybody about medicine is really helpful. And just sort of being able to structure your answers, maybe knowing what to do when experiencing, maybe feeling a bit uncomfortable when you don't quite know what to say, is also something quite valuable. So ask people to question you, read the news, and you'll be absolutely fine.
Yeah.
Hello. I want to know that would you mind to send the PowerPoint to me through email, please?
I am not entirely sure if we're sending them out. I can speak to the I think more senior part of the team. I'm not entirely sure if we do send them out, but usually all of the presentations will be on YouTube, in like a presentation format. So if you do want to go back to anything, then you can always just find it on YouTube and then look for like sort of scroll through to find the slide that you want. Yeah, I'm not entirely sure if we're sending them out. That's the only thing. I'm sorry.
Okay, thank
I'm
you.
not sure. Sorry. Chloe, do you know?
I'm not too sure, but
Yeah.
it will be on the YouTube channel. I'm going to send the link to somebody to upload. So if you have the patience to maybe just scroll through the YouTube channel, you can see our examples, if that helps.
Yeah. Okay. Hi, is work experience abroad okay? Chloe, do you want to answer this one? I don't mind.
I don't personally think it really matters where your work experience was. Mine wasn't particularly clinical. Mine was in a care home, and then I had a volunteer role in a primary school locally to me. But as long as you can demonstrate that you've used communication skills, that maybe you've been resilient or you've used teamwork, that's all that matters, really. Those are the important qualities that you need as a doctor. Nobody will go around asking you as a doctor, oh, did you do your work experience here or here? As long as you can demonstrate that you've taken things from it and that your experience will make you a better doctor, that's what matters.
Yeah, I completely agree. I was in the exact same position. I didn't have any hospital work experience until after I'd already applied. So yeah, it was just a care home and a primary school. Same. So yeah, literally as long as you can reflect on those experiences, then you're good to go. So if it's abroad, not a problem. Yeah, just make sure you can reflect on it. Okay. Can one station ask multiple questions? If so, do they tell you they will ask more than one question before starting? Generally, I don't think so. They usually bit like a theme. So it'll be a theme of questions as opposed to like one question. So they'll title, for example, the station, ethical or ethical scenarios or ethics, or they might title it commitment to medicine, and that gives them scope to ask you multiple questions about that one topic. So yeah, they might not necessarily tell you, they'll ask you more than one question, but you can imply from, I guess, the way they're structured that they can have multiple questions per station. So do be prepared for that. And generally, I had 2 MMI interviews and 1 panel interview, but the 2 MMI interviews that I had, all of the stations, every single one, there was multiple questions. So it depends on whether or not you finish really answering the questions, but they have enough just in case people have shorter answers to keep asking. Yeah, would you agree?
Yeah, they are well prepared when it comes to that. Some people will yap on for 5 minutes, whereas some will maybe answer in about 30 seconds. But
Yeah.
the interviewers might also adapt their questions to the way that you've answered. So tell me more about this, or tell me more about this. Or maybe they'll have a proper structure to follow and to make you sort of open up a little bit more. But don't worry about being too short with your answers, because they will find a way to ask you a little bit more.
Okay. I think in the interest of time, we might just finish the presentation and then come back, and then we can end the recording and then come back to the questions. So we haven't forgotten them. They're still here. We will answer them. I think we'll just finish the presentation so that we don't, overrun. So I'll just go back to sharing my screen really quickly, just so we can finish the presentation. So let's go back to this. Okay, so yeah, this is where we were. So if you've still got questions, please do put them onto the Slido. And then this is just a quick thank you for everyone who attended today. Please do fill in the feedback form. It's really important for us to sort of get to know yeah, how you found it. So if you want to say there was too many typos, please do. And yeah, whatever you fancy. But yeah, please do tell us if it was helpful for you, if it wasn't helpful for you, if you'd like to see more like this. So us to go through more MMI stations or less MMI stations, anything at all that you can think of, would be really helpful for us to know. So do fill it in, and thank you so much for joining. Hopefully that was enjoyable and that was useful for you as well. So yeah, do scan the QR code. I've also put the link onto the chat as well. So if you aren't able to scan it, it should be on the chat. And then we can stop sharing and stop recording. Thank you guys for coming.